Today, we are fortunate to have with us Dr. Suresh Raghavaiah, a distinguished liver and pancreas specialist and multi-organ transplant surgeon trained at prestigious Mayo Clinic in Rochester, USA. Dr. Suresh has led his team to perform the highest number of pancreas transplants in the state, and that's the third highest in India. With expertise in liver, kidney, and pancreas transplantation, Dr. Suresh is also a renowned expert in treating complex liver conditions such as hepatitis, jaundice, cirrhosis, liver cancer, and biliary diseases, making him a leading figure in this field. I am so glad we are right here with him right now at Spandana Hospital, Mysore Road. Welcome to the show, Doctor.
Pleasure to be here, Ms. Mansi.
We've got like a series of questions that people have asked.
Okay.
So these are the frequently asked questions, especially when it comes to transplant.
Sure.
And because this is the infection prevention week, I wanted to focus on it from Spandana hospitals.
Sure.
So the first question they have asked is, why is infection itself such a major concern when it comes to transplants?
So infection is a concern not only in transplants but in the general population as well, because the amount of infections are increasing day by day right now. Especially people are coming in multiple times to the hospital and they're getting these multi-drug resistant infections. And when it comes to transplant patients, their immunosuppression levels are going on, so their immune system is not working very well, and God forbid they develop an infection, they are going to have a much more worse outcome compared to healthy people. And this is the reason why infections are much scary in even transplanted patients.
What are the most common infections that we see among these
transplant
people?
patients? So when it comes to transplant, we always make sure that the donor does not get any infection, because he's a healthy person. God forbid he gets an infection, we treat it very aggressively. Now when it comes to transplant recipients, he is prone for all infections, be it bacterial, viral, parasitic or fungal infections. But the most common infections we see in transplant recipients is a bacterial infection. Now why does this happen? These people are in and out of hospitals many times, and like I explained previously, their immunity is not working very well. So they become much more prone for bacterial infections. Now where do these bacteria come from? Bacteria can be from inside, from your intestine, from your urine, whatnot, or it can be from the hospital-acquired infections. Now, some patients who are very sick, because we give them a lot of antibiotics, they are much more prone for fungal infections as well. Like if they have had a catheter for a long time, or an intravenous hemodialysis catheter for a long time, or they've had multiple surgeries because of some complications, fungal infections do play a very important role in complicating the recovery of a transplant patient.
Doctor, we have spoken so much about this. So what steps should these patients take so that they are not infected at all?
Okay.
What are the couple of things, the top 4-5 things that they should be doing?
So hopefully if a transplant has gone off very well and if the organ is functioning, be it a kidney or a liver, generally the recovery of the patient is very smooth. We are not very much worried about infections. But now let us say that the patient has come late to the hospital, he is very sick before the transplant. That puts him at a much higher risk of developing an infection after the transplant. So this is why we say, when you have any organ failure, be it kidney, be it liver, be it any organ failure, it's very important for you to seek medical attention fast so that we can guide you and get on with your transplant. The more you delay the transplant, the more number of times you end up coming to the hospital, and more the risk of you acquiring an infection from the hospital. Now, once your transplant is done, it's very important for you to take care of yourself. The simplest protocol is whatever you were doing during the COVID period works very well. Wear a mask when you're meeting people. Do not shake hands with multiple people, or if you do shake hands, make sure to use a hand sanitizer. Make sure you eat only nice, healthy, freshly cooked food, hot food, and more importantly, do not eat anything from the outside eateries, because it's generally cooked in a very unhealthy way. Drinking water, try using only boiled and cooled water or bottled water if at all not possible. But general hygienic practices will go a long way in preventing you from getting an infection.
With that, we come to the end of this episode. Thank you, Doctor, for patiently answering all those questions for us. Health challenges can be, whether it's physical or mental, can be very scary. At Spandana Hospital's Mysore Road, we have specialists from all domains. So feel free to ask away your questions and our specialists will answer it for you. You can leave your questions in the comment section below and we will pick it up for our next episodes. Thank you for watching.